We don't have it. We don't have it.
Yeah, we do. We do.
Yes. We have.
I'll say yes.
No.
No, not really. I always use a private clinic that is close to my estate because there is no government clinic close by. So I use the private clinic. But we have a medical center far from my estate.
I don't use anyone at the moment, no. To be honest, it's not been 100%. So there are many times when I need to do something or get some test or scan done and I'm being referred to multiple places at the same time. Or I'm having like different doctors just moving me around because many of them don't know exactly what to do.
Really, if we go to private healthcare, they usually give you good attention. But when you go to the public, you know, there's population. There are people, sometimes it takes your whole day.
Most times there are always issues of finance from patients, you know, because the economy has some issues. So things are not really well. There's poverty, there's lack of provisions and all that. So I think the government really needs to do something. They need to do something, you know, because the country that has good health, like people always say, health is wealth.
Honestly, it's poor. I will rate it in a scale of 1 to 10. I think I'll give it 3 over 10. It's very poor. It's very poor.
40%. I'm giving them 40% because there's no lights. Sometimes the equipment are not functioning. They are visible, but they are not functioning. The availability of staffs are 0%.
I think there was a time I rushed my nephew to the healthcare, and before they could even respond to us, it was taking a whole lot of time. So honestly, the services in our primary health cares in my own community where I stay Port Road is very poor.
Really, when my wife gave birth to my second child, in fact, in the medical center I used, the treatment was so poor. They did not hold the baby now very well. And when we took her home, it became a problem. We have to come back to the hospital to spend 1 week because of the carelessness of the nurse.
I think one of that was when my sister was having a child, her first child, and when the baby was coming out, they kind of like mishandled the baby's hand, so she had to, basically her shoulder, she had a nerve damage basically, and they didn't let her know about it until days later when we noticed that the baby wasn't moving her shoulder. So yeah, it's just one of those things.
I've seen people that have experienced such, and it was an horrible experience that we don't want to discuss about.
The government are not paying too much attention to the health sector, So it's a very important thing for the government to pay more attention to it, invest in the health sector.
To be honest, it goes a bit far, even into the educational system in terms of like training doctors. So many of them are not well trained with like proper equipment and all that. And secondly, there's not enough funding for, for the hospitals, clinics or whatever. I don't think the government prioritizes healthcare as much as it should.
The healthcare of Nigeria need to be monitored. That is the first thing. These people need to be supervised by external bodies. Because when they are giving, when they are doing something that is for government, they don't pay more attention to it. And many of the public healthcare you see, the private healthcare you see are owned by people from those hospitals. Sometimes they will refer you to a clinic, a private clinic that is owned by them. But if they are being monitored, all these things will be taken good care of. But they are not monitored, they do anyhow. Sometimes the doctors themselves come to vote very late because they are attending to patients in their private hospitals. So for the government to improve on their hospitals or clinic, they have to monitor those nurses and doctors.
Okay. I think the only thing that is making the healthcare not being active in Nigeria is because we have poor government that are supposed to look onto it. But they sometimes they don't have their children or their families coming to the healthcare. And sometimes they take their family to outside of Nigeria because they know that they don't have anything to do with it, and they make everything become so down and so poor. But if at all they used to visit these healthcare communities, they will have a need to see that, okay, they want to develop, they need facilities to put in there. But it doesn't come to those such environments. So, it make everything become so castellated, and it's not working at all, it's not working.
I think government are not really giving more concentration about our healthcare system in the country. And the private sector are actually doing better, which are very expensive. You understand, the private sector are very expensive in terms of healthcare, while the ones that are supposed to serve us, they are not being given much attention. In fact, their facilities are so low, like low quality facility.
I think it's just the government neglecting some issues. It's not as it's really that bad, but it's just the poor communication,
As you've heard, the reality is beyond just policies. It's about real people trying to survive and live comfortably. Nigerians are not just hoping for change, they're demanding practical and lasting solutions. The big question now is, will things truly get better? And when?